Hi, I'm Dr. Robin Thompson. I'm from Trillium Integrative Medicine here in Bozeman, Montana. And this is my March 30th COVID-19 update. A lot of the doctors and I around the country, a lot of my colleagues have been doing research, much talking to each other, trying to keep up to date on all the COVID-19 stuff, and there's more that comes out every single day. So I just want everyone to be aware that we are working on it, we're reading everything we can, and we're learning a lot. We have drive-through testing here in Bozeman, Montana, and many other places in the country that requires a doctor's order. I am one of the practitioners in the country that can do telemedicine and do an order for you if you have symptoms or you've had an exposure. So you can call our office at 406-219-0049 if you want to get on my schedule for an acute visit for getting tested for COVID-19. You can also get in touch with me about any risk reduction strategies you would like to put in place. Sometimes that depends on what your own health issues are, and so it's important that we talk about you as an individual. You can also talk to me if you do have a mild case of coronavirus that doesn't require going to the hospital. We have a lot of experience with chronic and acute viruses. It's one of the things that I love treating and always have. Number 2, cleaning hacks. We have a great video on YouTube, Dr. Van Wingen, who's an ER doctor. We can put that link below. He did a great video on how to clean grocery store items and take out boxes, etc., and bags. And I think that one of the things he mentioned was to wash fruits and vegetables in soap and water. And I would like to just offer an alternative to that I think actually works better and isn't as damaging to the fruits and vegetables. Fruits and vegetables are porous, as he mentions in the video, and personally, I don't want to eat soap. An alternative, we actually use this in our lab and in our IV area to clean surfaces before we work with sterile objects. This is taking some white vinegar and putting it in one spray bottle and taking hydrogen peroxide and putting it in another spray bottle. What you do is you spray the vinegar on the counter, or the vegetables or fruit, you spray the hydrogen peroxide and then you wipe it off. Let it sit for just a few seconds and wipe it off, and it's just as good as using bleach. Third, public restrooms. This has been a question of mine for a while. The research came out of China that doctors and nurses may have been exposed to COVID-19 through flushing toilets that aerosolizes fecal and urine particles. It became a true concern because in our public restrooms in the United States, they often do not have covers. They don't have lids, and if that's the case, that could be a huge source of exposure for people. Going into a public restroom with aerosolized potential virus particles is a huge concern. One of the things that I think is really important is being able to find something you can use for a mask. You can use a scarf, you can use all sorts of things at home if you have, it's better than nothing. But you can also find patterns if you have a sewing machine, you know how to sew, or you know someone who does. There are patterns that even our hospital here in Bozeman, Montana uses. They are better than nothing for sure, and it is such a huge concern. Gloves also, if you don't have, medical gloves or gloves that people use for cleaning, or you can wear your winter gloves. You can buy cotton gloves apparently on Amazon and just wash them over and over again. Making sure that you're staying in the restroom as little time as possible. You are using a toilet seat cover. You are using paper towels to turn the water on and off, and to even use the soap dispenser with. Before you get in your car, making sure you're not touching your phone, you're cleaning your hands with whatever you have available, whether that's a little soap and water, whether that's hand sanitizer before you touch your keys, before you touch your phone. I keep them in my car. I wipe down my gloves. I wipe down my steering wheel. I take off my gloves. I wipe down my hands again. This is the stuff that we know from people who are in Italy. This is the stuff they're doing. They're actually quite suspicious that a lot of infection is coming in on people's shoes into homes. And if you notice, the authorities in Korea and China are washing the streets twice a day. And that's because all these little particles can stick to lots of places. We have some control and we can do things to prevent our risk of transmission. I know that there are still people who aren't socially isolating, and that's so irresponsible. But even beyond social isolation, I think we all need to be extra careful and do kind of this crazy stuff. Number 4, I think that a lot of people are having a hard time finding supplements and whatnot, such as vitamin D3 and vitamin A and C and zinc. We have here at Trillium connection with Fullscript, which is an online supplement store, and Wellevate, which is an online supplement store. They still have a lot of those items. Even though they do run out of them, they're being really good about getting them restocked. If you need access to some of those supplements, which we know are very impactful, and there's tons of research about this, get in touch with our office, 406-219-0049. We also have some things still in our clinic we can mail order to you. Don't be afraid that the preventive stuff is being run out of stock. It's still around. We all have the power to do nutrients and supplements that we know can make a difference with risk. We know can make a difference with treatment as well. I do think it's really interesting that New York hospitals are using IV vitamin C to treat their acute COVID-19 patients. And even though it's not a double-blind placebo-controlled study, I'm really intrigued to see what data they come up with at the end of this. Number 5, and I always like to give people positive things that they have control over that they can do to contribute in every video that I do. One is that back in 1918, 1919, with the flu outbreak then that killed 50 million people, which is really amazing. One of the things that they would do for people in the hospital is try and get them outside every day during the summer months because it really helped them get better. The reason they got better is because it helped increase their vitamin D levels. So sunlight directly interacts with the kidney to produce vitamin D in our bodies. Vitamin D is very important for immune system function. So that's, other than taking vitamin D in a supplement form, that's another thing you can do. I also think the fresh air was probably helpful to them. The other thing that sunlight does is it stimulates your pineal gland to produce melatonin. And melatonin is also one of those things that helps your immunity. Sunlight is important in a lot of different ways. So get outside. Number 2, there are surveys out there, and I think one of the ways that all of us can really help and have an impact and not just watch the news and feel powerless is we can actually contribute to some of this knowledge and research. One survey is conducted by the University of California, San Francisco. If you have an Oura ring that tracks your sleep, it also tracks your temperature. They have a survey that people who have the Oura ring are taking every day to say, I feel fine, or I don't feel fine, and here are my symptoms. A huge help to research. There's another survey, and there are probably several, but there's another one out of Boston Children's Hospital and Harvard University who are working together, and their site is called COVID Near You. The site has some issues being able to, like you're supposed to enter your phone number and they can text you a reminder to do the survey every day, but that's not working very well. So you do have to go in there and just fill out the survey every day with your zip code. That's something they've been doing for over 10 years. They started Flu Near You about 10 years ago, and they've been tracking people that way. So it's really interesting research and really helpful. And they have a map on there with people who have symptoms, across the United States, people who've been tested across the United States, just by their zip code, not by their specific address. That's something that if you want something to contribute to this whole situation, that's something that all of us could do. So thanks for watching. I'm Dr. Robin Thompson at Trillium Integrative Medicine at Bozeman, Montana. We do telemedicine all over the country, all over the world. Our phone number is 406-219-0049. Our website is www.trilliumclinic.net. Thanks for watching.